Ladies and gentlemen, my name is Kirill Lobastov. I'm from Moscow, and I would like to introduce you the results of our study. The title of my presentation is Caprini score in venous surgery, the first results from the ongoing registry study. I have nothing to disclose. The aim of this study was to validate the Caprini score in patients undergoing varicose vein surgery, especially endovascular procedures, and to identify individuals at the elevated risk of postoperative VT who will benefit from prophylactic anticoagulation. To achieve this goal, we designed a prospective cohort trial based on the platform of the ongoing registry of the treatment of chronic venous disease, and we included in this trial the patients over 18 years old with varicose veins of C2 and higher SID clinical classes who underwent any kind of venous surgery and underwent clinical and obligatory ultrasound examination between 2 and 4 weeks after the procedure. The outcomes of our study were assessed at 28 days after the intervention, and they included any venous thromboembolism, particularly the asymptomatic DVT and symptomatic DVT and P, as well as a endovenous thermal induced thrombosis and any kind of bleeding complication. We analyzed this data in July 2020, and we found more than 1,000 records, and of them only 700 were eligible. Our dataset includes the patients in the mean age of 48 years old, and most of them were women, and they had the predominantly C2 clinical class of varicose veins and were treated predominantly for the reflux on the venous veins. In most cases, the intravenous laser ablation was performed, and the concomitant treatment of the tributaries was done only in 37% of all patients with mini phlebectomy or ultrasound-guided sclerotherapy. The procedure was done under the local anesthesia in most cases and in the outpatient facilities. The distribution of the Caprini score is found on this diagram. As you can see, all patients had the varicose veins, and most of them underwent the minor surgery, and some of them had the swollen legs, and the other risk factors are represented. And the Caprini score ranged between 2 and 11, and the mean score was 3.9. All patients received the elastic compression, predominantly with the medical compression stockings of the class 2, and the duration of compression was about 28 days, and prophylactic anticoagulation was performed only in 12% of patients with low molecular heparin or direct oral anticoagulants, and the mean duration of anticoagulation was only 3 days. The results of our trial are represented in this table, and the venous thromboembolism was found in 38 patients, which corresponds with the incidence of 5.4%, but most of these cases were represented by the asymptomatic DVT, the incidence of 2.9%, and the YEHIT of the class 2-4 incidence of 2.4%. Only 3 cases of DVT were symptomatic, and the incidence is 0.4%, and no cases of the symptomatic PE were registered in this trial. The localization of the deep vein thrombosis was restricted by the calf muscle veins in most cases and extended to the peroneal veins and femoral veins only in 2 cases. There was no any bleeding events detected in our trial. The correlation between the Caprini score and the incidence of postoperative VTE was significant but weak. As you can see, the patients with the registered VT had the significantly higher Caprini score of 4.6 when compared to those who didn't have VT, 3.9. We made a single factor regression analysis to find out the most important predictors of the postoperative VT, and they were age, Caprini score, inpatient treatment, treatment of the tributaries, mini phlebectomy of the tributaries, and anticoagulation. However, in the multiple factor regression analysis of all these predictors, only inpatient treatment and anticoagulation were significant. As you can see, the Caprini score lost its significance as a predictor for postoperative VT. We analyzed the incidence of VT in patients who received the prophylactic anticoagulation in different subgroups of the Caprini score. As you can see, in most of the subgroups, the patients who received anticoagulation had the higher incidence of postoperative VT compared to those who didn't receive anticoagulation. And I want to remember that the duration of anticoagulation was only 3 days, and the patients who received anticoagulation, they had the higher Caprini score than those without anticoagulation. What about the other outcomes of our trial? The significant correlation with the Caprini score was observed only for asymptomatic DVT and asymptomatic heat of class 2-4 or 1-4, without any correlation with the symptomatic VT events. So we concluded that the incidence of asymptomatic VT and 28 days after the modern brain surgery is 5.4% and predominantly represented by the asymptomatic DVT and hit. The incidence of symptomatic VT is only 0.4%. Caprini score demonstrates a significant but weak correlation with the risk of postoperative VT, and according to our data, we were unable to find any cutoff of the Caprini score to predict the postoperative VT. Despite most of the VT events occurred in the patients who received prophylactic anticoagulation, the duration of prophylactic anticoagulation was very low. It was only 3 days, and we suggest that some patients with higher Caprini score may benefit from the prophylactic anticoagulation of the adequate duration. Thank you very much for your attention.